Holly Kovo from Fitting Fitness In. I'm a personal trainer and nutrition specialist, and welcome to Get Healthy with Holly. Today I'm very happy to have a guest, Dr. Gill Thomas, with me. Thank you for coming.
Hi, thanks, Holly.
And Dr. Gill is he's a professor of orthopedic surgery at Tufts University School of Medicine. He's the chairman of orthopedic surgery at Stewart Healthcare Network. He's the director of Boston Sports Medicine and Research Institute. Also the director of New England Baptist Hospital Sports Medicine Fellowship Program. Previously the head team physician for the New England Patriots for 16 years. He's the medical director of the Boston Red Sox, as well as a team physician for Boston Bruins. Well, you're in there. Also, he serves on multiple national sports medicine committees and societies and has published over 200 peer-reviewed articles and book chapters. Very impressive.
Oh, thanks, Holly.
You like the sports, huh?
I like sports, yes, yes.
Awesome. So how do I know Dr. Gill? Well, Dr. Gill is my orthopedic surgeon through all of my injuries and surgeries, as well as my gel injections, and most recently, my PRP injection. PRP stands for Platelet Rich Plasma, and I thought it would be a great show because a lot of people need to know about this. I think it's a great new technique or a new medical breakthrough, I would say, and I'd like to educate other people on it.
That's a great topic, Holly, and the whole thing about sports medicine, for both of our fields, you're in sports medicine as well in many ways, and it's about how do you keep people as active as possible for as long as possible. Right. In the old days, you kind of think about, oh yeah, my grandparents, they weren't so busy, they weren't so active, they'd sit home and play cards. Well, that's not what it's about. Sadly, I think I'm going to be a grandparent before too long now.
Sadly?
I'm excited to be a grandparent, but to think of myself I still view myself as, in my 20s sometime. But people today are more active than they've ever been for longer periods of time. And I see that in the field of sports medicine, some of the greatest advances have been non-surgical techniques to try to keep people active, treat early arthritis without having to jump right to a joint replacement, which then by definition limits their activity. And platelet-rich plasma and orthobiologics, as the field is called, is just one of several different initiatives that we have right now going in the sports medicine community that I think has a lot of promise.
That's great. I work with what I call active agers, people 50 and older, and they are active. And my goal, I'm a functional aging specialist as well, is to keep them functioning longer in life. So yes, active agers.
Absolutely.
So let's talk about the PRPs, the platelet-rich plasma injections. Give us a little idea. What are platelets? What is plasma?
So a lot of people come in and in this field, there's a lot that's been written. There's a lot of reports that come out. There's a lot of advertising. People see that their famous athlete was flying over to Germany to get some fancy stem cell injection. And, basically everybody's looking for a way to reduce pain, to feel better, and as we've been talking about, to stay active. So platelet-rich plasma is a type of injection that we do. It's a treatment modality that uses the body's own blood and the cells of an individual then to treat that same person. So if you think about it from a safety standpoint, you can't get anything safer than using you to treat you, right? So what we do is we draw blood, just if you're going to donate blood. You come to someone's office, you come into my office, we draw your blood, it comes out in a little syringe, and then we put it in a mini centrifuge and we spin it down. And what happens when you spin a centrifuge, the blood is made up of a couple different parts. There's the plasma layer, which is largely water, but it's the liquid part of the blood. And then there's the cellular layer, primarily red blood cells, white blood cells, and then platelets. And as you spin, they all have different weights. And so when they spin around in a circle, they separate out so that rather than having, just red blood, you'll have, red at the bottom, which are the heavy red blood cells, something called a little buffy coat, which is more of the white blood cells, and then a clearish yellow area on top. And that's where the platelets are going to live. And those are the cells that we want to use for this therapy.
Because the platelets help regrowth?
So the platelets in general, the primary role when people think of platelets is platelets help for blood clotting. And so when you cut yourself, it's the platelets that kind of migrate to the wound, and they'll form a little fibrin blood clot, and that forms the scab, and that basically stops the bleeding. So platelets are extremely important to help prevent bleeding. But within a platelet, there's these little things called alpha granules. And it's in these parts of the platelet that there's some very interesting chemical factors called growth factors. Growth factors are, think of them as little chemicals or little types of things that can help tell cells that don't know what they're going to be when they grow up, called stem cells. They help direct them in a certain area. So some help make fibrin, which is used for clots. Some is used to help make platelets grow more. Some are helped to make people stronger. But think for wound healing, reducing inflammation, increasing inflammation, all of these types of growth factors can be used to help treat overuse tendinitis, partial tears of a tendon, muscle injuries, and more for early stage arthritis.
Wow. Well, it certainly has worked for me, because I am, I think 15, 16 weeks later, and my knee is just fantastic.
That's great to hear.
I'll tell you, I don't know, what you had told me was that it kind of stays the same with the arthritis. You don't get worse, but I find that I don't have the pain anymore.
I think you're spot on. What I typically tell patients is, look, if you've ever had a cortisone injection or a steroid injection.
Well, I had all of that.
I know. Yeah, the great thing about those is it's kind of instant gratification. Like when you would leave my office, you are probably already feeling a little bit better. And some of that's just because of the Novocaine, the lidocaine that we use in the injection as well. But cortisone has usually a very rapid onset, which is a powerful anti-inflammatory agent. But it also tends to taper off quickly.
Yeah.
And in addition, cortisone or steroid treatments are really just treating symptoms. They're not actually altering the structure of your joint. What the goal is with these orthobiologics and things like platelet rich plasma is not only are we trying to get rid of the inflammation or get rid of the pain, but you're trying to make that kind of cartilage that might be a little bit aging, that might have some early arthritis, you're trying to make it stronger to prevent further breakdown. Some people think it helps build cartilage. I'm not sure that I've seen enough evidence to be able to say clearly that it does that, but it clearly does help strengthen, I think, what you have there, prevent further breakdown, and then at the same time, get rid of inflammation, get rid of pain.
Yeah, well, I'm looking forward to it lasting a good long time. I'll tell you, I had the gel injections too. I think 3 years of gel injections every 4 or 5 months. So I was very excited when you said you do PRP.
Well, the gels are interesting. Gels are this group of treatments called viscosupplementation that are primarily made up of a chemical called hyaluronic acid, which is something found in normal cartilage. And for people that have had gel injections, it's like a lubrication. And so if you look at the length of action of all these types of treatments for patients, cortisone is the fastest onset, but also the fastest to wear off. I would probably put gel next, which is just a straight lubrication type of
DW40.
DW40, it's a perfect analogy. And then platelet rich plasma, or PRP, has the potential to last the longest. So I usually tell people, look, it takes about 3-4 weeks sometimes. How long did it take you to start to feel an effect?
I was feeling it probably within a week.
Wow, that's quick.
I did everything you told me. I didn't exercise. I taught my classes from a chair.
Which is hard for you.
Yeah, it was. But I also know that when you do what the doctor says, you get the results you're going to get. And I have to promote that to my clients as well. So I set the example. But yeah, then I started in 2 weeks, and I was doing, just the concentric or eccentric movements. And, by, I would say 4 weeks, I was doing everything I normally do.
Great. Yeah, that's about, that's that early initiation of the effect. And I usually tell people, look, you'll know by 12 weeks whether it's helping you or not. If you're not better by 12 weeks after a PRP injection, just getting another one is not going to help.
Right.
And you should have a pretty good idea which way you're headed around 12 weeks.
Well, and there's different places too that have different philosophies. That's why I went to you, because I trust you. And some other places, well, you go 3 injections right in a row, and I was like,
I think you have to be a little careful, and it's something we don't like to talk about in medicine. We like to think we hold ourselves to a little higher standard, but there is a financial incentive, I think, for a lot of places that you see it advertised in magazines and on TV. Come in, for this regeneration place, because it's all cash based. Insurance doesn't cover, and I think it's important for your viewers to know.
Yes.
Insurance companies don't cover a lot of these orthobiologic treatments, and it's cash out of pocket. And that's why I always also encourage you, be a wise consumer. Check what the cost is with, you want to ideally stay with your physician or your caregiver, but look around your area to see what the costs are. I'll say in Boston, it's widely variable. It's probably 2 to 3 times cost. There's people that are literally 2 to 3 times what our office would charge for the same thing.
Definitely. I mean, because I talked to other trainers that have had it, and it costs $3,000.
Right.
And but I have talked to another orthopedic surgeon I had on my show last year, and he said, I don't do that either. I just charge what,
There's
like
a certain
you
cost.
charge
There's a certain
the cost
cost for the kit that you have to buy, then a small markup because of the overhead and stuff. But it's really about how are we trying to help our patients. But it's important, again, for your viewers to know that if someone says, well, I want to give you 6 PRP injections spaced a week or 6 weeks apart, you might want to get another opinion on that and kind of see what the other options are out there and what science that's based on.
Absolutely, absolutely. So what injuries do these work on?
I found that platelet rich plasma there's a couple of types. If you are a high-level athlete, or say a laborer for that matter, where it's very important to get back very quickly, and let's say you were training and you pulled a hamstring muscle or a quadriceps muscle, you had a muscle strain injury, there's some data that shows that early administration, not right away, you kind of have to wait for that initial inflammatory response to happen, but say 5 to 7 days after injury, a PRP injection might help that muscle heal faster and either return to play more rapidly or return to your job, if you especially can't afford to be out of work that long.
Right.
So for muscle injuries, acute muscle injuries, it can help. I found it to be particularly helpful for either something we call tendinopathy or partial tendon tears. So for people who have chronic tennis elbow, which I'm sure a lot of your viewers who are rackets
I know, even myself, I was like, maybe I need to do it on my elbow.
Well, that's where a lot of the initial data came from. So tennis elbow is a very, very common one. Patellar tendonitis, so for runners, runner's knee type of thing. That is something that it can be very helpful for. So muscles, tendons, and then more and more for kind of early to moderate arthritis as a disease-modifying type of treatment. Not disease-curing, but disease symptomatic modifying. It's being used a lot for that as well.
Right. Well, and so that's interesting because, when I went in after we looked at the x-ray and you said that I'm a good candidate for it, you went out, the nurse came in to draw the blood, and she's like, well, you're lucky because she doesn't tell everybody they're a good candidate for it.
No, and that's important. If you have what we call bone-on-bone arthritis, which you obviously don't, but if you have an x-ray and the bones are coming together and someone's trying to recommend PRP injections or something like that, I would be careful about that because the chance of that helping is not great.
Right.
You want to have, ideally, in my mind, in an ideal world, at least 50% of your joint space left. Maybe a little bit more can be worn away, but you still need to have some space. So those are a lot of the orthopedic uses. I think in the cosmetic world, people are using it more and more for hair growth or hair restoration, for wrinkles and
is that what they're doing
fillers
on the face? I was going to ask you about that.
Yes.
Well, I know about the hair because I mentioned to somebody I know, we were having dinner, and I said, I just got a PRP injection. He said, oh, works great. I got it on my head, and my hair, and his hair is all grown back, nice and curly.
I think I might need a few PRP injections for that, so I'm not sure I'm ready to jump and say that it's going to cure hair loss.
Well, it
but
works for him.
It's certainly used a lot.
He wasn't totally bald yet.
Yes, I understand.
So what's the difference, though, between PRP and the stem cell injections?
So the people sometimes, the way I like to explain it is they're very different, but they're trying to do the same thing. So the PRP is trying to, in some ways, modify the healing response by maybe affecting the differentiation of stem cells or increasing the inflammatory response or decreasing it in some way to help healing. Stem cells, what a stem cell is, you've heard of red blood cells, white blood cells, fibrous tissues, different types of platelets, whatever. A stem cell it's called undifferentiated. It has the potential to go one of many different ways and form a bone cell, a cartilage cell, or something like that. So stem cells are being used because if you're missing cartilage in the knee, cartilage, for instance, or any joint, cartilage doesn't have a good capacity to heal itself. So the thought is if you can put stem cells there and then in some way convince that stem cell to become a chondrocyte or a cartilage cell, maybe we can help combat arthritis that way. The difference is it's much more complicated. There's something called bone marrow aspirate concentrate, or BMAC, where we actually take little coring biopsies from part of your pelvic bone called your iliac crest and aspirate out blood from the bone, because that's where these called mesenchymal stem cells come from. So it's more invasive, more painful, certainly a lot more expensive, and no one has really shown me a good study that shows any more beneficial results that I've seen for a lot of these indications we've talked about than PRP. But again, people are looking for that holy grail of, I don't want a joint replacement, so I'll try anything. I encourage your viewers to be careful of that mentality, because not every treatment is right for every patient.
Right. You have to look at the x-rays and see where everyone is. What are PRF injections?
So PRF means platelet rich fibrin. So it's similar to PRP, platelet rich plasma, with a couple of differences. Most platelet rich plasma, you can have leukocyte rich or leukocyte poor. Leukocytes are white blood cells. And there's a lot of, not controversy, there's a lot of dialogue, which is better for what indication. As a general rule, and there's definitely going to be some practitioners who differ in this because it's not an exact science yet, but as a general rule, people think that adding white blood cells to PRP, or what's called leukocyte-rich PRP, might be better for tendon injections and muscle injections, because the white blood cells can simulate an inflammatory response, and inflammation is needed for healing. Whereas for a joint injection for arthritis, we like leukocyte-poor. We don't tend to want to use a lot of white cells because we don't want to have an inflammatory response in the joint. What platelet-rich fibrin is, it's a leukocyte-rich, so lots of white blood cells, and it's spun differently. So rather than separating out at a high speed and getting rid of all those heavy red blood cells and everything else, what the fibrin they try to do is not just get the platelets and plasma, but also get what's called fibrin, which can help form a clot and helps keep all the cells and the growth factors concentrated in a much smaller space. And also the way it's collected in a tube that doesn't have what's called an anticoagulant, something that prevents clotting of blood. So it's a little harder to handle because it might clot up before you can inject it, but the goal of it is when you inject it, because it doesn't have this anticoagulation, it'll concentrate in one place, have a higher concentration of both platelets and growth factors. It's got fibrin, which will then help healing. And so the goal would be, and you see that a lot more for people that are using it in their face to try to get wrinkles. Rather than using fillers, they'll try to use this platelet-rich fibrin to kind of smooth out the skin and fill up a hole. With the goal being, again, just not to have it spread out as much.
Wow. So that's what cosmetic surgeons are doing now?
There's a lot of it, yeah. And there's, for people that either have autoimmune problems or who are allergic to hyaluronic acid, which is used in a lot of the injectable fillers that people have, platelet-rich fibrin can be used. And again, because it comes from you, the chance of you being allergic to it or having an adverse response is much lower.
Wow. I don't do that stuff, but it's interesting to hear. But I did, when I was doing my research, I was seeing all these pictures of people getting them in their face, and I'm like, she's pretty young. What is she doing? I mean, is that well, obviously it's cosmetic.
Well, yeah, I think for better or for worse, with the advent of Botox, people are just, think it's no big deal. Let's just, Botox everything. And I see my own patients, they're teenagers or early 20s go in for Botox treatments, and I don't get it. And I think,
Yeah,
unfortunately, it's lowered the bar and lowered the threshold for people to say, sure, I want to do that and I'm going to do that for Botox. But then now they say, well, maybe for the fillers. If it's good, if Botox is fine, I'm sure these fillers are fine. I'm sure this other treatment is fine.
Right.
And that's where it's really important to have a heart-to-heart with your caregiver, and do your own research as well, as you've always done, to make sure you go in with the knowledge to have a good conversation to find out what treatments are best for you.
Yeah, definitely. And I mean, parents have to deal with what their teenagers or young kids are doing and approve all that stuff. But
well, also,
that's on
every
them.
time they're on Instagram or TikTok or any of the social media platforms, they'll see someone else, this beautiful person or this handsome person, and they're advocating a treatment. Well, what that person has to understand, that person is getting paid to do that, right? But as soon as they see that, kind of word spreads like wildfire, and it drives the demand. It's a business at the end of the day.
Wow, I want to look like him, or
Right.
I want to look like her.
Right.
Absolutely.
Yes.
Oh my goodness. So, what would when did you start doing the PRP injections?
Oh, we've probably been doing it for about 10 years now.
Really?
Why'd
Why'd you wait so long with me?
Because we had other options that we thought. We're getting more and more data now on the right indications for it. And we used to think that we didn't do it as much for arthritis. We did it more just for tendon and muscle injuries.
Oh, okay.
I think the
All right, I forgive you.
the arthritis indication has come a little bit later. But one of the probably the most famous advents who was a player for the Pittsburgh Steelers, who was a wide receiver named Hines Ward, that sprained his medial collateral ligament of his knee. And this was all in the newspaper. This is not protected medical information.
Yep.
But as before, I think they were going to the Super Bowl or some championship game, and in a way to try to get him back on the field faster and have it heal faster, they were doing PRP injections, and he got back very quickly. And I think that's kind of spread the word in the sports community even more than it already had been. This has been used in Europe for a very long time, and it's been used, in the United States, I would say more recently. But that was kind of what really got it to be a little bit more of a household name. And now you have people coming in and asking for it. And it's an ethical question that comes up. If you have a treatment that doesn't have a 100%, I can't give you 10 randomized, prospective, perfect studies from multiple centers that come in and say, this definitively works. Should I be offering that to you? If there's no absolute yes or no. I would say in medicine, there's very few things that are absolute. So I think the question comes up, if you have a treatment which you will advocate for as yourself, you're going to give your own opinion about it. If it works for you, it's safe, it comes from you, there's little if no potential side effects. And as long as you're educated about also the fact that it's not covered by insurance, then you can make an educated decision. Does this seem right for you? And I'll just tell you from my own anecdotal experience with patients, maybe about 75% of my patients that get PRP respond the way you do, if not 80%. Others will say, you know what, I'm certainly not worse, maybe a little bit better, or I'm just the same, it didn't work.
Oh my gosh, I could feel it working. I could feel the energy zipping around in my knee. I didn't have a chance to do the laser because it was just too far for me.
Yep.
And my chiropractor said, no, it's a different frequency. But I'm sure that if I did that ortho laser along with it, it would have sped it up.
Yeah, so the ortho laser is another type of treatment modality that's being used right now. The American Academy of Orthopedic Surgeons has come out and listed it as an accepted treatment algorithm for the treatment of early arthritis. The goal of all of these types of treatments are, how do you kind of increase blood flow to the area? How do you dampen down an inflammatory response that's caused by arthritis? How do you decrease symptoms? And like we talked about in the beginning, get people back doing the things they love and staying healthy.
Right. Wow, you have been a wealth of information, Dr. Gill. Thank you so much for being on the show. I really appreciate it.
It's great to see you as always, Holly.
And thank you for joining us, and I'll see you next time on Get Healthy with Holly.